Push up. Boom.
Yes.
No power. Diagonally.
Cannot.
Boom. No power.
No. Oh.
What are you feeling? Burning?
Mm-hmm.
Yeah? Okay. Straighten your left.
This is better now. I couldn't do this.
Yeah?
Yeah, I couldn't.
There we go.
I couldn't.
What's up, everybody? Dr. Ranen here. Today we have Adnan, who's come through with some gluteal pain of 3 weeks duration. Adnan is a professional bodybuilder and personal trainer here in Dubai. He's been coming to see me for a couple of months now, and we've worked through several injuries. This gluteal pain started 3 weeks ago, and he's finding it difficult to train legs. So he's in a bulking season at the moment, off season.
Yeah.
And yeah, we're gonna assess him and see what's going on. All right,
Let's see.
let's take a seat for you. Take a seat for us, please. Okay, so we'll just start off with checking his neurology, dermatomes, myotomes, and reflexes. All right, can you feel that?
Yeah.
Same both sides?
Yeah.
Here,
Yes.
here,
Yes.
here,
Yes.
here,
Yes.
here, here, here.
Yeah.
Okay, lift your toes up for me, please. Push up. Good. Push up. Good. Bend your toes down. Push down. Good. Push down. Good. Lift your foot up for me. Not your leg, just your foot. Push up. Good. Push down. Good. Push up. Good. Push down. Good. Pull your leg back. Hamstring curl. Good. Push forward. Good. Push forward. Good. Pull back. Good. Lift up for me. Push up. Hip flex here. Up. Good. Down. Okay. This side up.
Feel
Down.
like this one is weak. A bit.
Okay. Let's get you to stand for me, please. Turn, face that way. All right, so we've been through his dermatomes, myotomes, and reflexes. Everything's intact, no sensory loss, no motor deficit. Now we're going to go into our range of motion assessment and orthopedic examination. Any pain in the lower back?
No.
Any pain in the lower back?
No.
Any pain in the lower back?
No.
Any pain here?
No.
Any pain here?
No.
All right, bend forward slowly for me and tell me if you start to feel any pain on the top of the glute.
No.
Go, go, go. All right,
Slightly stretch on this.
slight stretch.
Yeah.
Okay, and up for me. Okay, sit please. So his range of motion is free and full. We weren't able to reproduce any pain on our range of motion examination. Now we're going to check out if he has any positive nerve root compression tests. So it's left glute, correct? Let's start with the right side. Straighten your right leg for me. Point your toes towards you. Chin down. Any pain in the lower back? Slouch forward for me. No, keep your leg up. Slouch forward for me. Chin down. Any pain in the lower back or stretching?
No.
Nothing. Relax. Straighten the left leg.
This one cannot.
You immediately feel it.
Yeah, I mean,
Okay.
in the glutes.
Relax. So this is a perfect example of a patient that is not presenting like a textbook nerve compression syndrome, sciatica, or lumbar radiculopathy. He has completely intact neurology. His range of motion is fine, but as soon as we compress that nerve, boom, he feels it. Okay? So this is like 70-80% of the patients that I see in practice. They come in with a sport-related injury, which is actually underlying cause of a disc pathology. Let's get you to lie on your back for me. One of the main reasons why the confusion persists is because of how the pain manifests. It's not traditional. So patients not having excruciating pain all the way down the leg. This is why we do a thorough examination starting with the nervous system. All right. Relax your leg for me. Leave it loose. Relax, relax, relax. Starting to get any stretching in the leg or any pain in the lower back?
No.
Now,
No.
nothing.
No.
Okay. All right. Tell me how it feels, okay? Relax. Tell me when you start to feel it.
No. Only
No.
when seated.
Only when seated. All right. Relax. Relax, relax. If I do this,
Yeah.
what do you feel? Nothing.
No.
Good. Relax. All right. So we've just done the straight leg raise, which is also a test we use for a nerve compression. Sometimes both the slump test and the straight leg raise can be positive, but when we have a positive slump and a negative straight leg raise, it generally means that the nerve irritation is not that profound, which is a good thing. For Adnan, it means within a couple of sessions, you should see some improvement. So we're going to continue now. We're going to move into our manual muscle testing. Let's get you to raise your leg for me, please. Hold, push up. Good. So this is rectus femoris. Turn your foot out. Push diagonally. This is psoas. Push across for me. This is your adductor longus. Relax. Bend the knee. Push in. This is your adductor magnus. Push in for me. Better, but you're struggling, eh? Relax.
Yeah.
Right. Push inward. Also struggling a little bit, eh?
Yeah.
All right. Let's get you onto your side for me. Bend the bottom leg. Straighten the top leg. Lift up. Hold. Right. Push up for me. This is glute min. Not bad. Come back for me. Hold. Push up. This is glute med. Let's get you face down for me, please. You good?
Yep.
All right. Let's continue on with the muscle testing. We're going to test the hamstring. This is your unaffected side, correct?
Yep.
Yeah. Let's go. Hamstring curl. As we see, we got good power in the hamstring. We're going to test the glute. Lift up, hold, push up for me. Push, push. Good. Relax. Let's do the opposite side now. Hamstring. Push. Good. Lift up. Hold. Push up. Boom.
Cannot.
Cannot. All right. Relax. Okay. So we're going to just go into our palpation now. Get an idea of where the pain is coming from and what we need to treat. So this is the level L4. Oh, sensitive, eh?
A bit.
L5, S1. So you can see as soon as I touch him, He's sensitive. Look, I'm not touching much. I'm just pushing on the skin.
Yeah.
Okay. Right. Oh. Sensitive when I push on there.
Now, no, it's fine.
Here.
You mean as in pain-wise?
Yes.
No pain.
When I push on here, take note of how that feels, okay?
Does it feel ticklish?
Here.
It's a bit painful, this one.
Here. Here.
No.
Here.
No.
All right. So just this level here is sensitive.
Yeah,
Okay.
this one.
There we go. So that is L4. All right. Now we're going to do some sensitivity tests. Okay. Is this ticklish, sensitive, painful, ticklish? There we go. All right. Let's go on this side here. Ticklish or painful?
None.
Ticklish or painful?
None.
None. Okay. Ticklish or painful?
None.
Ticklish or painful?
Nope. None.
Ticklish or painful?
None.
Ticklish or painful?
This one is a bit like
Sensitive.
sensitive, yeah.
Okay. Here,
Sensitive.
sensitive. Here,
No, none. It's
none.
just a bit of sensitive because of the calves training I do daily.
Here,
Yeah, same.
sensitive.
Yeah.
Here,
No.
here, no.
No.
Here
Yeah.
and here, sensitive.
A bit.
Yes? Okay. So let's do some palpation of the glutes, get an idea of what's going on. Sensitive. How does that feel?
This area is a bit sensitive. Here.
But you are having sensitivity more deep
I think so.
Correct?
Yeah.
in here.
Yep. This.
Okay. So, any pain when I do this
No.
or this? In here? No.
No.
All right. Let's get you on your back one more time for me, please.
Okay.
All right. Any pain when I do that? Like what you're experiencing?
No. No.
Okay. Any pain when I do that? No. So this is your quadratus femoris stretch test and your piriformis stretch test. So when patients are experiencing this deep
Just a little bit
gluteal
of
pain,
tightness.
okay. When patients are experiencing this deep gluteal pain in the buttock, commonly therapists will refer to it as a piriformis syndrome. Now we refer to it as a deep gluteal syndrome because there's more than one gluteal muscle that may compress the sciatic nerve. So when we do this or do these deep gluteal assessments, Adnan's not getting any pain in that area. It does not mean that those muscles are not tight. It maybe can indicate to us that it's not the main cause. Turn your foot in for me. Push against my hand. Yeah, go. Any pain?
No.
No. And as you can see, these muscles are quite strong. Push outward for me. Push, push, push. There we go. So again, if it was being compressed by the quadratus femoris or the piriformis, he'd be in quite a bit of pain while doing those resisted isometrics. He'd also have little to no power in those movements. So we're going to assume that this is a discogenic issue. You can see he's got sensitivity at the level L4. He's got motor deficit in his quad, in his glute, adductor. So there's obviously some type of neural irritation. And we're going to go ahead and treat those things over your muscle. Right? So as soon as I touch you, you are moving. Okay.
It just happens to my right side of the lower back,
On the lower back, okay.
right side.
But normally when we assess you, you're not that sensitive, okay?
Yeah.
So again, I think what is happening is you have some type of disc irritation,
Okay.
even though you're not manifesting with lower back pain,
Yeah.
all right?
Yeah. No pain.
You can have nerve irritation without lower back pain. That is what a sciatica refers to.
Okay.
It refers to nerve irritation, which can be anywhere from the buttock to the knee, not isolated buttock and knee.
Oh, okay.
Okay?
Okay.
Doesn't mean that it needs to run straight down.
Okay.
With or without lower back pain.
Okay.
Okay?
Okay.
So we're going to go ahead and do some electro stimulation. We're going to fire up this this leg. What tends to happen is when you have this nerve irritation and muscle weakening, the weight of the leg pulls on the hip and lower back. It becomes more strenuous for the person to walk, and this creates a nerve irritation in itself. So what we're going to do is fire up all these muscles. Then we're going to work on desensitizing the sciatic nerve at a root level, so in the lower back and then down the pathway of the sciatic nerve. We'll do some nerve flossing, and we'll reassess the slump test, which is our most provocative assessment. Disinfect the skin. For me. So I don't need to explain this to Adnan. He's done this several times. For those of you who are not familiar with me or with what I do, part of my treatment protocol is to use percutaneous intramuscular electrostimulation or medical acupuncture, hashtag or inverted commas dry needling with electrostimulation. This is a acupuncture pointer. It's used to identify and stimulate acupuncture points on lines of meridians, or on meridians rather. And what we do with this is it basically puts out the same type of electro frequency as TENS. So what we do is we use this to stimulate the acupuncture needles. Most people do it in insert the needles into the muscle that they're trying to stimulate, whereas I try to stimulate specific nerves. So what we're going to do now is the rectus femoris or quad is supplied by the femoral nerve. So what I'm going to do is I'm going to go right next to the femoral nerve, and that's what I'm going to stimulate. So what I'm just palpating for here is the femoral artery. So you have femoral artery, femoral nerve, and then a femoral artery, femoral vein, and then femoral nerve. So I'm just palpating for it. If I was using ultrasound, I'd come right next to it. But what I'm going to do here is I'm just going to step a little bit away, and I'm going to go into more the muscle belly, or more into the muscle, rather the muscle belly would be a little bit further down. We're still in the space of the femoral nerve, and now we're going to start to stimulate. So Adnan, as soon as you start to feel it, oh, there we go. We're in a good spot. We're getting action almost immediately. You good?
Mm-hmm.
You're good. So you would see that all the muscles along the pathway of the femoral nerve are being stimulated. You see the adducts are pulsing. You see the inner aspect of the quad. Okay. This is also because we're getting some stimulation of the obturator nerve, which supplies the adductors. You good? So normally when you get this, how fast do you feel better?
Right after the session.
Okay, bend your knee for me, please. Sensitive. So what I'm palpating for is the TFL, and just in the vicinity of the TFL, you have the lateral femoral cutaneous nerve, and this yes, this sends sensitivity down the outer aspect of the quad. So we want to stimulate this as well. How's that?
Yeah.
Good. Adnan has had a strain of the quad. How long ago? Towards the beginning of the year. Yes?
Yeah. 12 weeks.
12 weeks ago.
Yeah.
So how long have you been competing for now?
I competed since 2016.
2016.
Oh,
Yeah. And essentially, the competition prep stopped about 12 weeks ago because of this hip injury. So just relax your leg for me. So obviously what we have going on here is some type of muscular dysfunction or stability or stabilization dysfunction or lack of stability rather, which is putting a lot of pressure on this hip and potentially the lower back. So that is something that we will need to look at addressing as soon as Adnan is better. So you're going to relax for me, relax. So here we have the adductor magnus. We're going to just go medially to that, into here, and then stimulate. There we go. You good?
Yep.
You all right?
Mm-hmm.
So you may be asking yourself, what are you doing? Are you just stimulating the nerves to give him back some power? Yes and no. No, because what we also want to do is desensitize any branches of the sciatic nerve or any peripheral nerves that may be feeding to the sciatic nerve. We want to desensitize them so that we reduce any pain sensitivity, or we want to desensitize them to break the pain cycle. And we do this through various different ways. You could do muscle work by loosening up all the muscles. You could do this by nerve tracing. You can use percussion massages. You can use cupping. Therapists use several different ways. This is just my way that I go about it. This one over here makes your little man get longer. Train SF is crazy busy now, huh?
Super crazy, man. It's like a fucking fish market. They say Nogs was off for a week,
Yeah,
so all those members came here. It's
it
kind
was insane, bro. Like, you get there at 6 a.m. and you can't even get a parking. Okay, so what we're doing is we're going to do a stimulation of the psoas. So I just want to palpate the ASIS. I want to move laterally. Relax for me, please. And then we're just going to go in here and down.
Yeah.
What are you feeling? Burning?
Mm-hmm.
Yeah? Okay. It feels very rigid and tight in here.
Yeah, extremely. This side.
We'll come back to that. We're going to go into our next area of stimulation. Here we're going to do the posterior femoral cutaneous nerve. It is what provides sensitivity to the lateral aspect, posterior lateral aspect of the body in patients who are having nerve irritation. It also starts to refer down to the lower leg. So we're going to start by doing a stimulation here. And then we're going to do the glute max. So I'm just going to palpate the greater and lesser trochanter, and then I'm going to go 50% between them and slightly higher up, and then we're going to needle towards that ASIS. Boom, done. Feeling it in the butt?
Yeah.
Yeah. You see them cheeks shake. OnlyFans, we have a new
Yeah.
model. We have a new model for you here. 50% discount for the next week. No, 50% discount for the first 50 clients that sign up.
Sign up, yeah.
There we
Ah,
go.
this one
I'm gonna
hurts.
reduce that a little bit. Okay, better?
Yep, yeah.
Getting some nice stimulation through there. Okay. Come around this way. Q. All right, so we're going to do the lower back now. For those of you who can see, if you can see how hypertonic this entire left side is. Hypertonic means it's enlarged, it's swollen, the muscles are tight. If you look here, it goes down. If you look here, it's pretty continuous all the way through. That's another indicator that it's coming from the back. You have this really strong guarding reflex. Oh, and you can see the hypothesia. Hypothesia is a medical term used to describe sensitivity over the skin, especially when it's felt as a result of light touch. It usually indicates a deeper nerve irritation or nerve sensitivity, joint sensitivity, disc sensitivity. We're going to hook Adnan up to our battery now and shock him, because shock therapy is always effective for crazy people. So here we have two needles at the level of S1 and two needles at the level of L4. What these are going to do is they're going to help to fire up the muscles that are stabilizing the disc. Can you feel that?
Yeah.
Light, mild, or strong?
For now, it's light,
Now,
mild.
how's it in the leg?
I feel slightly down the hamstring on the left.
It's okay?
Uh,
Too strong?
just too strong on the right lower back.
Right lower back, okay. How's that now? Talk to me.
Similar.
Now,
Yeah, better.
better, okay. We've just done the sciatic nerve, posterior femoral cutaneous. We've worked on the lower back. Now what I want to do is I'm going to work on the medial cluneal nerve, and I'm going to work on it from two aspects, through the glute med and through the glute min. And this is going to help to not only fire up those two muscles, but desensitize that specific nerve, because during our examination, Adnan kept on pushing on this area here. This is the base of the sacrum, or the the PSIS. PSIS? Yeah, PSIS. Essentially, it is the sacrum. So there's no joint issue coming from this specific level, or at least based on his injury. But I think more it's a nerve sensitization or nerve irritation. That's why he's commonly feeling it in this area. So we're going to go ahead and desensitize now. So PSIS stands for posterior superior iliac spine. So we just palpate the PSIS and we go a third away from it and towards the PSIS. We may get a small twitch. You good, Adnan?
Yep.
Yeah. Right. We'll desensitize. Good.
Yeah.
Getting a good cheek shake.
Yeah.
Yeah.
At least now they'll grow. It doesn't grow.
It doesn't grow. What's the hardest body part for you to grow?
For me, upper chest and glutes.
Upper chest and glutes. Okay.
I never trained glutes properly ever.
Okay, so you feel that?
Yeah. I feel more in my hand.
Yeah. You got a scar. I got a scar tissue here. You. Yeah. There we go. There we go.
So,
Yeah.
what do you have?
Now you're gonna feel it. Feel
Okay.
that now? There we go.
Yeah. So I was not feeling it because of the scar tissue?
Yeah.
Okay.
Okay. So what we're going to do is we're going to use a percussion massager, and we're going to trace the sciatic nerve from its most distal part all the way up. So sciatic nerve ends here, but you have the lateral sural nerve, which is a branch of the sciatic nerve. So we're going to go all the way up. Okay. This is going to help to desensitize the nerve. When nerve tracing, you want to move always to the spine. You want to centralize the pain. If you look at him, you can see how sensitive he is. Starting down here, You can see how the muscle is shaking. And Adnan, am I pushing very hard?
No.
It's just the skin, correct?
Yeah.
What we're doing with this is we desensitizing the nerve from the skin down. We want to hit the nervous system with as many different looks as possible to confuse it and to make it think that there's no issue. This way, it can break the pain cycle, or we can break the pain cycle, and Adnan can get some rest from his symptoms. When Adnan's symptoms subside, he becomes a much better patient to work with. And this is not just Adnan, this is any patient. When patients come in, they don't say, I have a disc injury, I have a torn supraspinatus. They say, I have shoulder pain. Okay, when a patient comes in with neck pain, they don't say, I have an acute torticollis or I have a stiff neck. It's, I have neck pain. So once we're able to reduce symptoms, then we can really work in fixing a patient's issue. Pain management is always the first step. So this is what we're doing today. What I'm going to do now is I'm going to run from the outside all the way in. So here you have your lateral branch of the iliohypogastric nerve. It supplies your transverse abdominis, which is a big player in lower back pain and stabilization of the core. You have your internal and external oblique on the outside. Adnan's quite sensitive in this area, so or ticklish. Ticklish can be another form of sensitivity. Okay. All right. So while he is in this position, we're going to go ahead and muscle test him. Okay. So the biggest issue was the glute max. Let's get you to lift your leg up. Hold. Feel like you can hold it better?
Yeah.
Yeah. Okay. Push up for me. Push. Push. Look at that. Relax. How does that feel?
Yeah.
Much better?
Yeah. More control now.
There we go. All right. Let's get you on your back for me, please.
Okay.
Okay. Let's get your leg up for me. Hold. Push up now. Push. Push. Look at that. Turn the foot out. Push diagonally. Great. Push in. Fantastic. Bend your knee. Push in for me now. Push, push, push. Great. Okay, so how's the muscle strength feeling?
Better, 100%.
Better? Yeah? There we
back
go.
to normal.
So what we're going to do now is called nerve flossing or neurodynamic technique. Essentially, the nerve is being compressed somewhere. Relax your foot for me. The nerve is being compressed somewhere. We've tested the deep gluteal muscles. It's not coming from there. So the most likely scenario is it's coming from the disc. So what this is going to do is it's going to help to move the nerve where it's being compressed at a central level. And by doing that, it's going to free it up. Once it frees up, it's not going to start sending pain down its pathway, or it's going to be less likely to send pain. Or if it does, the pain is less. You okay? Relax for me. Man, this guy's legs are heavy. So when's your next competition?
Next year, probably.
Next year.
Yeah.
So Adnan's also done wrestling, right?
I was selected for WWE tryouts
Yeah.
in 2017 here in Dubai.
So he's been around the block of high level elite athletes and elite sport. Okay. All right. Shall we get you to sit for me? Let's manipulate you. Sit. There we go. So,
Is that right?
no.
Oh.
So we're going to manipulate Adnan now. Some of you out there who are fans of chiropractic and manipulation will ask at the end of this video, why didn't I manipulate his back? Now, I follow what's called the CRISP protocol, which is clinical reasoning in spinal pain. Essentially, when a patient like Adnan comes in who's very acute, he's finding it difficult to sit, not even for a long time, just sit at all. The goal in the CRISP protocols is to desensitize as phase 1. Once the patient is asymptomatic or has less symptoms, then we go on into manipulation of the spine. The reason is because the size and shape of a disc injury is not directly proportional to symptoms. So if he does have a large injury and it is acute now, I could flare him up. So it's my personal preference. This protocol is my personal preference of how I like to manage my patients. And Adnan being an athlete, I don't think he has any issue of us not flaring up an acute disc. Correct? Yeah. All right. So we're going to go ahead and we're going to adjust his thoracolumbar junction, or T12. T12 is where the nerve root that supplies your lateral branch of your iliohypogastric nerve comes from, which essentially stimulates your core. And I find that this area becomes really locked up in patients who are presenting like Adnan. So we're going to go ahead and manipulate that. Then we're going to retest his nerve compression test. All right. Let's get you to lie back for me. Yeah. Yeah. The last time we broke the microphone with Adnan's big back. This is an expensive microphone now, Adnan. We're investing. All right. So this is going to be tough. This man can't hug himself. Bring your elbows together as much as you can. Okay. Let's move this here. There we go. Let's get you to roll for me, please. Roll. There we go. Right, roll back. Inhale. Exhale all the way out. There we go. You good?
Yep.
I don't think the microphone picked that up, but inhale. Exhale. Okay. Cross. Inhale. Exhale. Okay. You good? The first one was the money one. Yeah. All right, let's pop this back in here. Okay. Let's get you to turn to your side for me. Sit. Sit for me. There we go. Okay. So, sitting was an issue for you. How are you feeling now?
Much
Sitting.
better.
Yeah?
Yeah.
Any irritation?
Not now.
Not now.
No.
Okay.
Let me check this.
Straighten your left.
This is better now. I couldn't do this.
Yeah?
Yeah, I couldn't.
There we go.
I could
Okay.
feel the stretch from the lower back
All the way down. All right, relax for me. So, immediately, Adnan's feeling less sensitivity, sitting in the buttock. We didn't work the buttock muscles at all, and he suspected that it was a muscle strain, but we didn't touch the muscle, so to speak. Okay, we worked specifically on the nervous system or the nerves passing through those muscles. We did no muscle work, and we normally do quite a lot of muscle work with him. So let's get you to straighten the left leg for me. Point your toes towards you, chin down. How's that?
Much
Good?
better. Much
Any
better.
sensitivity?
No.
Nothing at all?
No.
Okay, guys, so that brings an end to our session with Adnan. Today we'll put in some links of where you can find him and his training. For those of you out there who are looking for a PT, You wanna give your Instagram handle?
It's coached by Ali.
Coached by Ali. Look out for our next video or any other videos that we may have following up with Adnan. And don't forget to like and subscribe. Thank you guys very much.
Thank you.